I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
So really, we just want to assure all Kenyans that we are working very hard as a ministry, as a government, as a health sector, as a country, a whole government approach to addressing the challenge that is currently facing us of coronavirus. And the team that we have been meeting with this evening has been a team of experts, some health workers, experts in communication, experts in social media, all looking at how we work together to make sure that, number one, Kenyans are aware, they are well sensitized about what we are dealing with, that we all also learn what precautionary measures we need to take to ensure that we can prevent ourselves from getting coronavirus, and also to ensure that we protect our families. The team of experts here has been doing a lot of work in terms of their own practice, the clinical practice, the protocols around coronavirus. This is a new virus that the medics have never dealt with, that the entire health workers have not dealt with. Feel that you're very ill to go into a matatu, to go to hospital, we really recommend that you call the 719 line and get us to come and pick you through an ambulance which has got specialized facilities and with health workers to take you to an isolation facility where you can be tested. So basically, we are just aligning our coordination and making sure that we have a seamless operation even as we deal with coronavirus. And I just want to thank the entire team, the entire fraternity in communication world, social media world, our experts in health, for their for their commitment and self-sacrifice. We've been sitting here up to very late hours in the night, days on end, and people are here really just volunteering themselves to serve this nation. So my deep appreciation, and to all of us, please keep us hooked up to our conversations, be kept in the loop through hashtag Komesha Corona. Thank you very much.
Fellow Kenyans, in the last 24 hours, a total of 82 samples from suspected cases of coronavirus have been tested in various laboratories, namely the National Influenza Center, KEMRI Nairobi, KEMRI Wellcome Trust Kilifi, and Aga Khan hospitals. Out of the 82 samples, we have received confirmation of 9 people who have tested positive to the coronavirus disease. This brings the total number of confirmed COVID-19 cases in Kenya to 25. These confirmed cases are spread out in 4 counties, namely Nairobi, Mombasa, Kilifi, and Kwale. Out of the 9 confirmed cases, 7 are Kenyans, while 2 are foreigners. And of the 7 Kenyans, 3 have contacted the virus from close contact or previously confirmed cases, while the 4 others have contacted the same from countries that are affected with the virus. The new patients have already been taken into isolation in our facilities and are being monitored by our medical personnel together with others previously turned positive. Tracing of contacts for the new patients, as well as those of the previous patients, is ongoing. The total number of close contacts that we have so far been monitoring stands at 745. Out of this number, 98 of them have been discharged after completing the 14-day follow-up period. We now have remaining 647 close contacts that our tracing teams are monitoring. 15 individuals are currently admitted at Bagathi Hospital waiting test results. Following our directive on the 22nd of March 2020 that all international travelers arriving through our entry points that are undergoing mandatory quarantine in select hotels, government-designated facilities, and so on. I want to state that there has been challenges, particularly at the Jomo Kenyatta International Airport, as well as the designated hotels and government facilities, where we are taking the travelers for mandatory quarantine. This was bound to happen because of the huge numbers that are coming in, while at the same time, we do not want to leave anything to chance. However, we have streamlined the process, and this has been sorted out. In fact, we intend to introduce further measures to speed up the process and ease the inconvenience that we are clearly causing a lot of parents and a lot of passengers. I want to once again appeal to all travelers to bear with us as we continue to undertake this process. This intervention is aimed at stopping further introduction of virus in the country. And if you needed evidence that this is the case, just refer to what I've just said. On the better side of things, today we have received a donation of 25,000 testing kits for the coronavirus from the Chinese business magnate Jack Ma. On behalf of the government, I want to thank this gentleman for his generosity, as this will go a long way in helping us fight this disease. I also want to take this opportunity to thank those in Kenya who continue to support the government initiative, the business community, the parastatals and their boards, who continue to build water points, who continue to contribute towards resolving this issue. So we have both got international and national support. We shall continue to carry out mandatory testing for all contact cases, for all travelers who have arrived in Kenya, and generally speaking, we are going to increase and fast-track our testing processes. We will not necessarily have to be very suspicious. We only have to have a contact, and we carry out testing. And this fast-track testing might be the solution. We are also looking at possibilities of acquisition of fast testing kits, and are in discussion, particularly with the Chinese government, on this issue. You will all appreciate that getting anything connected with coronavirus from anywhere in the world is now a challenge and difficult. But we are also exploring the possibilities of supplementing what we are importing with local production, particularly in masks, in uniforms, and other gear. As I conclude, I would like to urge all Kenyans to fully support the measures being undertaken by the government to deal with this deadly virus. It is the only sure way to cut transmission of the virus and mitigate it in our country. I would like to announce that tomorrow we will be announcing further measures as in view and in consideration of the developments so far. So today, I wanted to give the report. As far as the measures are concerned, there are ongoing meetings as we speak. I'm going to back into one. And tomorrow we will be able to announce what further measures the government has decided to take to respond to the environment and the situation that is now presenting itself to us. Thank you very much, ladies and gentlemen.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
Consultation with social partners, we have set up a solidarity fund which South African businesses, organizations and individuals and members of the international community can contribute to. The fund will focus efforts to combat the spread of the virus, help us to track the spread, care for those who are ill, and support those whose lives are disrupted. The fund will complement what we are doing in the public sector. I'm pleased to announce that this fund will be chaired by Ms. Gloria Serobe, and the deputy chairperson will be Mr. Adrian Enthoven. The fund has a website, www.solidarityfund.co.za, and anyone
Afternoon, viewers, welcome to Punchline Africa Television, broadcasting all the way from Nairobi, the Republic of Kenya. Viewers, wherever you are, thank you very much for watching Punchline Africa Television. This is the only television station in Africa that discusses African issues, that talks about Africa, that minds about Africa and minds about Kenya. Today, the topic is very clear. It's COVID-19, coronavirus 19. There is nowhere else you can talk about anything else. You can't do it. You just need to talk about coronavirus, which has hit everybody, almost everyone in the world, is talking about it. We've made a studio to go about this topic of Kenya, not only Kenya, Africa. And I think Miriam will be in a proper position because it seems that my brains seem to be cut into several other parts to introduce the topic. And thank you very much. Introduce the topic. The topic is lockdown or not, no or not lockdown. Is it lockdown or not lockdown? Which way, Kenya and Africa? Most of the countries in Africa are locking down. Tunisia, South Africa, South Sudan, Uganda, partially locked out, borders closed. Zimbabwe, still the border is open. South Africa, from tomorrow, the army will be on the streets. So the question is, do you lock down? In Europe, London, lockdown. Only those essential can move down to the streets and buy food. Only when buying food and the facilities, only going to see patients, you can be given a permit. There is partial or overall lockdown. What way, which way Kenya? Which way Africa? Does the Kenya government lock down? Does it do partial lockdown? Or does it, what can we do at this moment? We are not suggesting we know anything that the government wants to do. But I believe, going by the trends, we are looking at the trends which are taking shape on the African continent. We believe this could come anytime, because if we are going to see people still making movement, still driving, still talking, still getting in groups, still going to church, you never know next week how many of them will go to church. There is definitely going to be a lockdown. Thank you very much, viewers. Let's look at the factors. But before we do that, I want to introduce my co-host right at the headquarters of FRONTLINE Africa Television Wide. Remember, this is a satellite station somewhere in the wilderness where we are in the political command post, miles and miles away from Miriam. That's why we have left her to smile alone, to enjoy the seat. Thank you very much. We are on lockdown. Thank you. Miriam, good afternoon.
A very good afternoon to you, Doctor. Indeed, it's a very heavy question, and of course suggested by one of the leading newspapers here in Kenya, the Standard newspaper, this morning. Lock Kenyans home, and you see a couple of leaders citing reasons as to why Kenyans perhaps should be locked home. And yesterday, when the CS of Health, Mr. Mutahi Kagwe, was issuing the press conference, they're still waiting for another one anytime soon. I think he should be giving daily briefings, so every time soon we expect either him but perhaps him to come out and give us the latest on the situation. But yesterday, while he was addressing the country, he said that he's very frustrated by Kenyans who are proving to be very difficult. Even just following simple instructions are proving to be very difficult. And Doctor, in the morning, I mentioned this while we were on the morning show. You were not present here today. Yesterday, I went to town in the evening to get a few supplies, and I was shocked to see some restaurants actually opened and customers seated and enjoying their meals. And the government was very clear the other day that all restaurants should be, in case they're operating, then the customers should just come in and get takeaways and leave, and nobody should be allowed to sit down. So when you see such incidences where even the owners of these restaurants are not adhering to these rules laid by the government, and even Kenyans who decide to go there and sit down and they already know what the government has said, that proves the point of the CS, Mutahi Kagwe, that Kenyans are indeed very difficult to deal with during this time. And perhaps, I don't know if a lockdown will be the right way to contain the situation, and not just only in Kenya, but across Africa. But we've seen South Africa, lockdown was declared, and they're not very happy about it.
Thank you very much. And you see the problem we have, Miriam, our people are stubborn. Ugandans are stubborn. For us, we are disciplined by Idi Amin. Idi Amin slaughtered most of us, beat most of us, caned most of us in front of our children, caned most people, drivers in front of their passengers. Therefore, the rule of law, the rule of fear, I think let's say the fear factor in Uganda of the law is higher. Someone fears. He fears to say, if I don't close this nightclub, people will come and close it very very, very, very forcefully. So there is that fear in Uganda. There is that sense of understanding in Tanzania. The agreement, Tanzanians agree that, Mwalimu alisema tufunge. Rais alisema munawe mikono. Tanzanians take that very seriously and they do it. When they wash their hands without anybody disciplining them. They close the restaurant if they have been told. Like now, if they have been told that don't go on Sunday to pray, they will go. They respect their president. They respect the authority. In Kenya, people tend not to respect. They belittle the minister. If you can see the type of comments that people are writing on Facebook about the Minister of Health, because he's saying something very, very trite. Some are saying, now this one is better than Matiang, this one Matiang is dead. All this type of stupid statements. People don't listen. The younger generation that has come on media, on social media, that goes on to insult people. They don't listen. We are the media. We are supposed to tell people, shut down the restaurants, because the president and the government said, shut the restaurants and the public bars. Buy your beer and go and drink it at home. If God created you to drink up to the end, even when there is an earthquake coming, you will drink and dodge the stones. Go and drink it at home. This is the time for people to make family reunion. There is no shortcut here. People must obey the law. People must obey the law. I speak from a military background. I'm not speaking as a civilian. A military background says, obey the law. We have to obey the law. Whether it is the right command or wrong command, take the orders. If they have said, close down the bar, close it. What are you selling? Are you going to go with that money to the grave? Are you going to the money with the grave? People know, you see people who have banked the millions. Are they not running the way we are running now? I'm asking people here, those who are engaging me, reason along with me. Are we not going to leave this money on us? Why don't you protect the lives of the people of Kenya? Why do you violate the rules until the minister cries on platform that Kenyans are very stubborn? For us Ugandans, we were eaten carnivorously by Idi Amin. Idi Amin used to eat our tongues. He taught us how to behave. So when they say, and I repeat, when they say close down, Museveni, if you don't close, Museveni comes. In fact, he told you yesterday, Museveni said he will send some younger men there to buy something and they find the price is too high. They close the shop there and then. That's why Kagame, we East Africans have got a habit. of not obeying. Kagame used both some democracy and a big dictatorship. He has got Rwanda today. If these planes were not going to Rwanda, there would be no corona in Rwanda. People are clean, people wash their hands, people eat food on the plate, not the one that has fallen on the floor. We in East Africa and other parts, we eat even the one on the floor, yet the one on the plate, you are going to throw it later. If it has gone down, leave it. Miriam, these are behaviors, this mindset. We have very bad mindsets. People here have bad mindsets, and we have a problem here. We better talk about it, which will make the government take a step to close down. Because if you are going to go on Sunday and pray and say, come, I saw some pastors even giving the Holy Communion. Did you see that on Sunday? I saw the pictures of Holy Communion being given by pastors. Yet, what's the problem, Miriam? What do you think is the problem?
I think that perhaps the African nations have not really understood the magnitude of this problem, the COVID-19. Right now, as we speak, even Spain has surpassed the number of deaths in China. Right now, Spain has over 3,000, about 3,434 people who have died. It has surpassed the number of the death in China. And remember, China led for a couple of days, and now, of course, Italy is leading, and Spain right now has surpassed that number. So this is, and these are countries that are pretty much developed, and their systems are pretty much, very good. So imagine if that should come to Kenya or another African country, another third world, then that the impact there will be in tune of tens of thousands of people who can possibly lose their lives. So I think perhaps the nations or Africans have really not understood. The majority of us have not really understood the magnitude of the COVID-19 and the potential it has to bring down a lot of lives. So perhaps we should continue creating awareness. Every country here in Africa, engage the media, engage the people, and engage the local leadership. And let's just continue creating awareness. And very interesting, Doctor. As we speak, there was a research that was carried out just between March 15th and March 21st in Kenya here. The research was conducted through phone interviews, and about 1,000 correspondents were interviewed in this, and they're just trying to test their knowledge and in regards to the COVID-19 here in the country. And it says on the research there is little knowledge on the fact that contaminated surfaces spread the COVID-19 viruses. So people just know that if you cough or sneeze, that is how you can get COVID-19. But if I sneezed and coughed at a surface and left that place and went, and you came and perhaps touched the same surface and it was not sanitized, because this virus lingers for around 3 hours in the air. So if I left the same place and you came back and you touched it, there's a potential that you will catch that virus even though I left that room. And so Kenyans were unaware that this COVID-19, you can pick it even from surfaces, not just from coming in contact with somebody who has sneezed or somebody who has it or somebody who has coughed. And so it is, you can find it through the surface. So there's little knowledge about that, so we need to create more awareness of that. If you touch a surface, make sure this surface is not contaminated, and wherever after you touch some surfaces you're not sure, go and sanitize, keep sanitizing. That is the way to go. Wash your hands, or clean these surfaces with disinfectants if you can, around the house and around your places of work, to ensure that any contaminated surface is cleared. And also in this research, according to the report, 72% of the respondents washed their hands. They say they wash their hands with soap and water, and some 39% use alcoholic sanitizers, compared to 26% who are currently avoiding shaking hands, hugging, or kissing. I don't shake hands anymore. You don't even come near me. So that is the new rule, and a lot of Kenyans are really embracing this. So 25% of the respondents have adhered to keeping a distance of at least 2 to 3 steps from people with flu-like symptoms, which only 3% have avoided crowded places and public gatherings. So this 3% who only 3% have avoided crowded places. So can you imagine the rest of 97% of us still find it necessary to go to these crowded places? And that is where the danger lies, Doctor.
Thank you very much, Miriam. The options are limited. The options are very simple. We either save or perish. There's no other third way out. We have to save. The government has to save the people. The government must take a stand. If they decided to go, like in other countries have gone, that's very good. Let's not play politics about this. There is no more second life about it. All of us are caught up here. There are people saying, go where? Uganda, or you go. Where do you go? There's death everywhere.
Especially in Uganda, you can't go right now, or anywhere, yes. I mean.
The death is everywhere now.
Yes.
Even if it is Uganda, it will find me. Even if it is Nairobi, it will find me.
Even UK is in a lockdown right now, yes.
It will find me. I'm here. I'm stuck here also with you. I don't want people to say that, oh, I ran away when there was a trap. This all perish. After all, there is one way to arrive to the kingdom of God. Is through the same. So we are ready to stand, but remain to disseminate information, to give ideas, to tell people what is supposed to be done. We shall not be cowed down. We want to support the Minister of Health, Mr. Mutahi Kagwe, who has done a commendable job, who has actually managed to stand against every, every bad situations. So that's the life of Africans.
Mm-hmm.
Which way we do. Miriam, the question I want to pose to you, in your honest judgment,
mm-hmm.
what do you want to do?
A lockdown or not a lockdown?
And not to lock down.
Well, for me, I really don't mind, because I know perhaps I have structures in my own personal life that, I could sit in my house and I will be fine. But look at the 2.5 million slum dwellers in this city. 2.5 million slum dwellers. This is a huge number in all the 200 settlements in this country that account for about 60% of the city's population. And for majority of these people right now, they don't even go to work, because the industries they work for are in the industrial area, and these other small-scale businesses have been closed down because of this coronavirus. So if we were to impose a total lockdown, a few of us might be able to cope, but a huge number of us will become very impossible. So even as we consider, because I think at some point this lockdown might be inevitable because of the manner in which this coronavirus is being spread, but these 2.5 million slum dwellers are low-scale income in this country. What are we going to do with these people who cannot afford to stock up for food even for 3 days? What is the plan? Does the government has something in plan before, even as they continue to seek for ways in which they can really contain this COVID-19? I think that is the bigger question.
So we are faced with a very huge disaster, which I believe is more important than the industries. I believe that people need to safeguard their lives than safeguarding the industries and the opportunity, the work. Now, how the government can do this, it needs how will you supply the food, for example?
Yes.
How will logistics are needed? Is it the money, the government, who is going to supply this food? Where is this food going to come from? If you are going to say those people don't go to work, who is going to pay them their daily bread? So these are the things that the government is grappling with, and I believe by the end of the day, the government will find out a solution, and a solution will come. And if it means total lockdown. We are having so many suggestions coming. Great discussion. Tabi Ogutu. This is your brother?
That is, I think that's my younger sister. That's our last born. She's watching somewhere from Maseno University. I don't know why they're not closed yet.
Yeah, that is your sister. Thank you very much, Tabi Ogutu. Thank you very much for watching us. We are here at Punchline Africa Television with Miriam. Oh, you have a younger sister there.
Yeah, she's studying journalism as well at Maseno University. Yes.
Oh, she's studying journalism.
So I'm happy. She might get some notes from you. She might learn something.
Oh, yes. Of course, she will learn quite a lot of things.
Yes.
Thank you very much, Tabi. And others, is our views of people, total lockdown and impose a martial law. Mr. Nahemeka
Kunwa. It's very punitive there.
From Biafra, I guess. There are so many people who have come up with several lockdowns. The world is coming to an end as we talk. Simon Deng, how long will you lock down all the shopping market malls in Kenya? Dominic Nandwa said, good day, Punchline Africa Television. Okay. And then we go to, so many of them have come up with, it looks like everybody is saying the dark cloud and it is certainly will pass.
Mm-hmm. It will pass.
This morning, I summarized it that way. The darker cloud will definitely pass.
It will pass.
There will be a lining, and the darker cloud will pass.
There will be a silver lining.
Yes.
Yes.
I don't know whether you looked at my essay this morning on the legacy trend. It's very good. It's doing huge numbers. Because I said Kenya, for us in Kenya, or people in Kenya, we have a problem. When they saw social distancing, you are socially interacting. And in fact, now Kenyans are socially interacting more than social distancing. Honestly. And we are now approaching the cold weather.
So there'll be more quarantining together. But
yes,
but from my experience, Doctor, because I've been up and about, I think you've been in isolation for quite a while. I've been up and about, and when I go to the supermarket, Kenyans actually, you can see they stand 3 feet or even farther from each other. So they actually there are a few of us who have understood this thing. And when you go to the public service vehicles, you don't share a seat. You can see they're actually trying to implement some of these measures put forward by the government. So as much as we have a section of Kenyans and other Africans who are tough-headed and very difficult in terms of their understanding, but we're also having a section of these citizens who are actually trying to implement and try to, make sure they adhere to these laws and these regulations that have been put by the government of Kenya and also by the different governments in Africa. So it's not all bad, not all Kenyans. I saw yesterday at the supermarket, people stand very far from each other because there are fewer people going there to do their shopping. So it is working somehow. But what I really wondered is when I went to pay, they tell us that they don't have gloves, they don't have the face masks, so they're actually exposed and they're still receiving the cash, the hard cash, and even the card sometimes could be contaminated. So they're not really protected. So I don't understand. And this morning, coming to work in the morning, I saw our police officers, they're manning the roads, they're trying to talk to people and all that. They don't have the gloves, they don't have the protective gears. So even them, they are on the front lines of being exposed. So what can we do then for these very important services that perhaps we can't get rid of right now, for them to make sure that even as they continue to serve the public, they also stand a greater risk of contracting this virus, and they are very oblivious. I saw the police officers, I saw at the supermarket attendants there, the workers, they're not protected at all.
So in your opinion, we haven't answered the puzzle.
Yes.
Do we lock down or we don't lock down?
The lockdown, I think it is becoming a bit inevitable where we are approaching with the numbers that keep swelling and increasing by the day. But the question is, fine, perhaps 10% of Kenyans can afford to stay on a lockdown, what will happen to the rest of Kenyans who cannot? Yeah, because that also now will pose another serious security challenge, and we have to come to terms with that reality. How do we handle that? That is the bigger question. Lockdown or no lockdown? Lockdown is inevitable. As long as we continue and the numbers continue increasing, there will come a point where the government has to say, you know what, we caught 2 Kenyans, no movement, no inter-county movements, stay indoors, and that's it, because you need to contain this thing. And that is very important. And for us to come to that point, the government would have deemed it important, and so we have to all are there. But a few of us can afford the sit in the house and just be okay. But what will happen to these other people? Does the government have plans on how it can take care of these Kenyans even during the lockdown? Because where we're heading, it seems it might be inevitable. We might get to where South Africa is today.
Thank you very much. God bring bad time, and God will bring good time.
Yes, He will.
It's time for everything. So let us pray God to take away COVID-19. Lockdown cannot solve the issue. Con Gak, thank you very much, sir. And then Tom Dominic Nwanda again. After the coronavirus, Africa will have to be expecting the shutdown of the economy and the calamity. Mm-hmm. That's true. There will be a meltdown.
There will be worldwide.
Yes. Today's analysis that I made.
Yes, later on in the evening. Yes.
Yes. I think it will be later on in the evening, even.
Yes, I think later on a doctor shall be coming to you with another show, I think in the evening. Let me just get you the topic there so that you can prepare adequately and know if you have questions you can ask him later on. International coordination and reactions of the nations to the COVID-19. Today is economic impact on Kenya and Africa, and the economic impact that the COVID-19 has had is just on astronomers levels that perhaps the world has not seen, but it is happening all over the place, and so in Kenya, Africa, and the world. So that is what the doctor will be looking at later on at 8 p.m. Tonight. But right now we're looking at lockdown or not lockdown. Which way Kenya? Which way Africa? All these cases that we've been seeing, and now we've seen the countries trying to cancel any flights coming from outside their countries. Like in Kenya here today, starting today, there will be no more international flights arriving in this country. This measure, doctor, is it a little bit too late? And we've seen a lot of African countries taking this measure. Is it a little bit too late, or is just okay? It's just on time?
I think, Miriam, let's look at, I think it's not too late, but it is too little if we don't do it. Let's not act like a UN that comes in too late, it does very little. The Kenya government is saying, let's help each other. Let's not leave the whole thing to one person, because it will create us many difficulties. Now, for example, Miriam, I want to ask a very honest question.
Yes.
Do we have a social contract in Africa?
We don't, and that's why I'm worried for that 80% of the population. Who will take care of them?
We don't have. Apart in East Africa, we have only Tanzania, which seem to have a social contract where their morality, where they think of their president. The rest of us in East Africa, we are beginning to build. Since 2010, the Kenyan government has been trying to put into place institutions that lead to a social contract. But these institutions are not yet there. We have the judiciary, yes, it is liberalized. You can go and say everything. We have the democracy in parliament, in freedom of speech, freedom of assembly, freedom of everything. But one of the things, the pillars of any democratic institution, any developing democratic institution, is the social contract. We still have obstacles, challenges that challenge the Kenya government For example, people are shouting at it today that they should get money and pay people money. How do they pay them? Even the checks that go to the retirement benefit for our old people take time to reach their places. Some of the people don't even get the checks. We still have a problem, a challenge here. Kenya faces, like any African country at this hour, faces challenges. And these challenges can only be, solved if there is an organized system, which the government is trying to do. Because the government, for example, cannot come and now announce that we are going to pay each and every worker. The minimum pay for each worker here is 13,000 shillings, isn't it? The minimum pay wage bill.
At the lowest.
It's about 13,000 shillings, which is $130. But the last employee of any company. So how many of these are employees? How many of these? Because if you are going to pay, you are even going to pay those who pay taxes. Remember, there are employees who are registered, who have registered with, this is, people are not seeing the consequences. That some of them, when we go deeper, they are not even on pay as you earn. Because that's the only way that the government can determine whom to pay and whom not to pay. So if there are people on KRA list, those are the people that they look for. And then you can now see the usefulness of the number, Huduma number. Circumstances like this remind us of so many things. When you look at the data that the government was trying to get, and which it had a lot of opposition, this is when you say, I wish we had this data. We could now know how many people are in Nairobi. We could now know how many of them need this or that, how many, where can we place the food, how much food can we place in a certain area. These are some of the things that make up what we call the good governance structures of a social contract. Kenya does not have that will of a social contract to compensate people like other people are demanding, to make sure that they pay for them, to reduce. The only thing that the government can do is to remove taxes. If it removes, even if it removes taxes, where are you going to buy the goods? The Uganda-Kenya border, there's a queue of 10 miles of trucks, 10 miles from Busia up to Busitema, 10 miles. My trucks are in there. That's how I've managed to know. 10 miles. The drivers have been sleeping there for the last now 4 days, tomorrow 5. What is that expenditure? Look at it. So we have difficulties, and as Africans, we must always. Mohamed Musa says we must always make sure that we appreciate what the government has done and give them a credit of what is they are doing. So this, at the end of the day, COVID-19 will create a harmonious, a passionate community. People who care now because they have seen the alternative of not caring is what? Is perishing. Yes, Miriam.
And as we speak right now, as I mentioned there earlier, Spain has surpassed China in coronavirus deaths. Spain confirms 738 more deaths from COVID-19 in the past day, raising the total number of the death toll to 3,434, second only to Italy. And also in Kenya here, the CS James Macharia bans pedestrians on ferries to stop COVID-19 spread. All passengers to be ferried in vehicles to ensure the social distancing. That is very important. president over there, and also an 8-month-old baby whose father had traveled from Kisumu among 5 COVID-19 cases in Uganda, bringing the total number to 14 there in Uganda. So we see Uganda is also catching up in terms of the infections there since the first one was announced the other day.
President Uhuru Kenyatta will address the nation later today. Just news breaking incoming. We shall tune and wait for His Excellency to address the nation anytime now. We don't know exact time, but it looks like there you are. We are going to have another address by His Excellency President Uhuru Muigai Kenyatta.
All right, and
one thing that Kenya has just done is importation of mitumba cloth has been suspended.
They should have suspended that 3 months ago.
Because now you can't bring that coronavirus, all of it here.
They're coming here. It has been coming.
Oh, no.
Yes.
So President Uhuru Kenyatta will later on address the nation.
Yes.
And Miriam, I think we have done our best, haven't we?
Maybe just before we finish up, there are a few countries in Africa that have introduced curfews and some partial lockdowns. Let me just go through the list very, very fast for the sake of our viewers who are watching outside of Kenya. And we start with South Africa, who have said it will enforce a 3-week lockdown, and from midnight on Thursday, March 26th, that is tomorrow, until midnight of Thursday, April 16th, all South Africans will have to stay at home. President Ramaphosa said the South African National Defence Force will be deployed to assist the South African Police Service. Like, we need the army to tell us to keep inside for us to be safe. I just don't understand the Africans, but there you go in South Africa. And in Tunisia, the country imposed a curfew from 6 p.m. to 6 a.m. starting on March 18th. And in Madagascar, the army has been called in to enforce strict confinement measures, although authorities face the challenge of ensuring vulnerable people have enough food to stay at home. And in Uganda, suspended all passengers planes in and out of the country starting March 22nd. Cargo planes will be exempted. And we go to Algeria, where the government suspended air and sea travel with Europe from March 19th. Authorities had previously halted flights with Morocco, Spain, France, and China. And in Senegal, authorities in the capital Dakar have destroyed an informal market in a bid to curb the COVID-19 outbreak. And Angola, the country has closed air, land, and sea borders. And in Cameroon, on March 13th, the government shut down land, air, sea borders indefinitely, and international flights were grounded except for cargo planes. And in the Democratic Republic of Congo, the country has closed its borders. And in Djibouti, on March 15th, Djibouti suspended all international flights. And in Ethiopia, that was on March 23rd, all arriving passengers faced mandatory quarantine. Ethiopia has also announced that it will shut its land borders to nearly all human traffic. And in Egypt, suspended all air traffic at its airports from March 19th until March 31st. And in the Gambia, the country has decided since March 23rd to close its borders with neighboring Senegal for 21 days. And Ghana banned entry to anyone who has been to a country with more than 200 coronavirus cases in the previous 14 days, unless they were official residents or Ghanaian nationals. And in Libya, the country has suspended all flights at the Misrata airport. I don't know who flies to Libya anymore, but there you go. And in Mali, suspended flights from countries affected by the virus on March 19th, except for the cargo flights. Morocco halted flights to and from 25 countries, extending an earlier ban that covered China, Spain, Italy, France, and Algeria. Nigeria closed its 2 main international airports in the cities of Lagos and Abuja from March 23rd for 1 month. And Rwanda, on the March 22nd, closed its borders completely, except for goods and cargo and returning citizens. So Rwanda is under a lockdown as we speak, and Somalia banned all international flights. Sudan closed all airports, ports, and land crossings. Only humanitarian, commercial, and technical support shipments were excluded from the restrictions. And Zimbabwe President Emmerson Mnangagwa announced that all borders will be closed to human traffic except for returning residents. So there you go. That is the latest from across African countries and some of the measures they have put in place to ensure their people are safe across the continent.
Thank you very much, Miriam. Thank you very much, viewers. We shall end here. But the most important thing is to lock down or not lock down. The government will make a decision. We wait what the president will do, but we have given you scenarios that can show if we lock down now, what will happen to other people who need that service? Has the government arranged for the money, for the food, for those who depend on the daily bread, and which supermarkets will be open and how will they be open? How will they be supervised? By the way, I saw something before we end, Stephen, I saw something in India. I have done it on my Facebook. Did you see it? I sent India. I don't know whether Stephen can bring that picture of India, of the Indian way of social distance and the shopping. Even the police are supervising the drawing where you stand. So can we copy some of these measures? These are countries that are preventing life.
Yes.
They don't want to lose life. They don't want to make it difficult for everybody. They have drawn the pictures. When you go, you stand there until you are served. The shopkeeper is very far from you. Stephen, have you got it?
And also something, Doctor, you mentioned there earlier, President Yoweri Museveni tweeted a few hours ago and he said nothing has caused the prices of foodstuffs to be hiked in Uganda. The banana we had yesterday are the same today. The maize is the same. So the crooks who are taking advantage of the coronavirus to hike prices of foodstuffs anywhere in this country will be arrested and their licenses revoked. There, President Yoweri Museveni, they are trying to caution, Ugandans against the scrupulous traders there in the country who are trying to take advantage of this unfortunate situation.
Thank you very much. And I want to take this opportunity to thank you all the time and make sure that you keep yourself. We see you today at 8 o'clock.
All right.
You will be corresponding. I don't know whether you have decided to sit there.
I'll be corresponding in isolation over the phone. I'll be corresponding. I'll be part of the show tonight. Yesterday, the show was really, really amazing. So today, I have to be part of the show, yes.
I was waiting for those type of comments.
Okay, good. I watched it.
So, as usual, they are given.
They come in late, but at least they come in, so don't worry.
They are given to someone.
We're together, don't worry. So today I'll be corresponding. I will be corresponding and I will be part of the show.
Okay, thank you very much. Viewers, thank you very much. That is diplomatic frontline security. One of the points that you must take home is as we seek to lock down, who will man the security? That's a very key important point, Miriam, which we have forgotten. This is where also terrorists, banker robberies, thieves, robbers come in now. So the government must look at all those aspects before they decide on what to lock down and not to lock down.
And speaking about security, Doctor, we are on frontline security. In the morning, I mentioned in Chad on Monday, Boko Haram killed 92 soldiers, and yesterday they killed 47 soldiers in Nigeria. So they're taking advantage of this COVID-19 to even cause more insecurity across Africa. So it's ridiculous. So you're right. We need to be vigilant.
Yes, it is very important, Miriam, for people to be vigilant at this hour. There are people who are saying lockdown. But we must have contingent plans of security. Has the government got enough security to make sure that every locked down situation will remain as it is before when it is found back again? There will be a lot of robberies. There will be a lot of break-ins. There will be a lot of theft. The terrorists could also strike. So we are at this level and we cannot just talk without thinking of what we can do. Thank you very, very much. And enjoy yourself.
All right, we'll see you at 8 p.m. East Africa time. Thank you so much for joining us.
Take care.
So really, we just want to assure all Kenyans that we are working very hard as a ministry, as a government, as a health sector, as a country, a whole government approach to addressing the challenge that is currently facing us of coronavirus. And the team that we have been meeting with this evening has been a team of experts, some health workers, experts in communication, experts in social media, all looking at how we work together to make sure that, number one, Kenyans are aware, they are well sensitized about what we are dealing with, that we all also learn what precautionary measures we need to take to ensure that we can prevent ourselves from getting coronavirus, and also to ensure that we protect our families. The team of experts here has been doing a lot of work in terms of their own practice, the clinical practice, the protocols around coronavirus. This is a new virus that the medics have never dealt with, that the entire health workers have not dealt with. Feel that you're very ill to go into a matatu, to go to hospital, we really recommend that you call the 719 line and get us to come and pick you through an ambulance which has got specialized facilities and with health workers to take you to an isolation facility where you can be tested. So basically, we are just aligning our coordination and making sure that we have a seamless operation even as we deal with coronavirus. And I just want to thank the entire team, the entire fraternity in communication world, social media world, our experts in health, for their for their commitment and self-sacrifice. We've been sitting here up to very late hours in the night, days on end, and people are here really just volunteering themselves to serve this nation. So my deep appreciation, and to all of us, please keep us hooked up to our conversations, be kept in the loop through #ComeshaCorona. Thank you very much.